chromosomal disorder called Turner syndrome impairs the development of individuals who are assigned female at birth. Normally, female have two X chromosomes. However, in people with Turner syndrome, one X chromosome is either partially or completely absent. Heart defects, ovarian failure, short stature, and other medical and developmental issues can all be brought by Turner syndrome. Girls and women with Turner syndrome need ongoing medical care from a variety of specialists. Turner syndrome may be diagnosed before birth, prenatally, during infancy, or in early childhood. Occasionally, in females with mild signs and symptoms of Turner syndrome, the diagnosis is delayed until the teen or young adult years. The characteristic of Turner syndrome is most people with Turner syndrome have normal intelligence, developmental delays, non-verbal learning disabilities, and behavioral problems are possible, although these characteristics vary among affected individuals. The symptoms of Turner syndrome are short stature. The average adult height is 143 cm. Babies with Turner syndrome may grow at a normal rate until they are 3 years old. After this, their growth slows down. At puberty, usually between 8 and 40 years old, a girl with Turner syndrome will not have a normal growth spurt, even with female estrogen hormone replacement therapy. The other symptoms are a broad chest and widely spaced nipple, arm that turn out slightly at the elbow, a low hairline, puffy hands and feet, pigmented moles, webbed neck, droopy eyelids, broad chest, low side ear, breast development may not occur, menstrual period absent or very light, and hearing problem. Girls and women with Turner syndrome may have some deafness caused by childhood ear infections. They may also develop nerve deafness caused by degeneration in the hearing nerve.
Next, what are the genetic causes of Turner syndrome? Turner syndrome occurs when part or all of an X chromosome is missing from most or all of the cells in a girl's body. One of the reasons is because of the mutation, which is chromosomal number alteration. It is a sex chromosomal abnormality that occurs during gametogenesis, and it leads to the production of monosomy X karyotype. During spermatogenesis, it is due to non-disjunction that occurs during anaphase 1 or anaphase 2. If non-disjunction occurs during anaphase 1, sperm with XY chromosomes and sperm without any sex chromosome will be produced. Sperm without any sex chromosome fertilized with normal ovum, which is X, will produce X genotypes, which is Turner syndrome. The same goes for the non-disjunction that occurs during anaphase 2. If sperm without any sex chromosome fertilized with a normal ovum with an X chromosome, X genotypes will be produced. While during oogenesis, it is also due to non-disjunction that occurs during the anaphase 1 or anaphase 2. If an ovum without any sex chromosome fertilized with normal sperm with an X chromosome, the X genotype will be produced, which is Turner syndrome. However, there is a possibility that the child produced is normal if a non-disjunction occurs during anaphase 2 of oogenesis. On the other hand, mosaic Turner syndrome is not an inherited condition. It occurs due to a random event during the cell division stage in the early fetal development of the affected individual. Mosaicism occurs when an affected individual possesses some cells in their body with a 45X karyotype and others with a 46XX karyotype. This error post-conception leads to a single-cell outcome, which is the zygote, undergoing repeated mitotic divisions, ultimately giving rise to various cell types throughout the body. Non-disjunction of sex chromosomes can also occur during any mitosis, leading to a cell line with 3 sex chromosomes, totally 47, and another cell line lacking an X chromosome, totally 45 chromosomes. Under normal progression of divisions, there is also a cell line with 46 chromosomes contributing cells to the developing fetus. The cell line with 47 chromosomes rarely survive. divide and generate more cells with only one X chromosome in addition to a 46 XX cell line, resulting in a mixture of 45X and 46 XX cells in the body.
The diagnosis of Turner syndrome. There are two ways in diagnosing the Turner syndrome, which is through prenatal screening test and postnatal test. Prenatal screening test is done before the baby is being delivered. Meanwhile, postnatal test is being done for patients with delayed symptoms. Firstly, CVS. CVS can detect if there are extra or missing chromosomes or if any have significant changes to their structure. This test involves taking a small piece of tissue from developing placenta. The placenta contains the same genetic material as the baby. The chorionic villi, which are formed from the fertilized egg, are tiny projections of placenta that look like fingers. The chorionic villi cells can be sent to the genetic lab for chromosome studies. The next one is amniocentesis. In amniocentesis, a sample of amniotic fluid is taken from the uterus. A fine needle is pushed through your skin, the muscle of your tummy, and then through the muscle wall of your uterus into the pocket of amniotic fluid. A string will be attached to the other end of the needle so that some of amniotic fluid are taken around your baby. Usually, between 10 until 20 ml of amniotic fluid are taken. The fluid can be sent to the genetic lab for study of the chromosome babies in order to determine the presence or absence of any abnormalities including chromosome of the baby. Next is karyotyping test. Karyotyping test is part of postnatal test that is performed to diagnose disease and developmental delays in children. Genetic testing with karyotype analysis is necessary to confirm the diagnosis of individuals who is suspected to have Turner syndrome. A karyotype analysis determines if one of the X chromosome pairs is missing from the full chromosome set, or if there are any structural differences in the X chromosome. If the initial karyotype is normal in a patient with clinically suspected Turner syndrome, a second karyotype should be performed using a different tissue like skin or bladder epithelial cells. The last one is cardiac MRI. Cardiac MRI has higher sensitivity to identify cardiac abnormalities in patients with Turner syndrome. MRI provides ionizing radiation-free of cardiovascular anatomy with good resolution of heart chambers, myocardium, and valve, thus enabling recognition of sonographically silent anomalies such as mild dilation of aorta and elongation of transverse aortic.
Management of Turner syndrome, or the treatment of Turner syndrome. There's no specific treatment to cure Turner syndrome, but the complication can be treated. First is growth hormone therapy. Growth hormone will help to increase the height of the patient through bone development. It is a daily injection, for example, somatropin. Second is estrogen replacement therapy. This will need to be taken start around time of normal puberty, which is 11 years old. We need to know that estrogen triggers changes in girls during puberty, for example, breast enlargement and body shape. Estrogen also maintains the health of the bone by avoiding osteoporosis and maintain the health of the womb. The third one is progesterone replacement therapy. This therapy needs to be taken after the estrogen replacement therapy. Progesterone will cause monthly period to start. Fourth, pregnancy and fertility treatment. As we do know, Turner syndrome patients have infertility, but through egg donation and in vitro fertilization (IVF), they can get pregnant. If they get pregnant, they need to do the regular checkup, especially heart checks. This is because heart and blood vessels are under extra strain during their pregnancy. This is to ensure the womb is fully developed and healthy for successful pregnancy. Lastly, Turner syndrome patients need to have regular health checks. But what did they need to check? First is hearing through ears. During this patient's childhood, otitis media may develop, and this must be treated rapidly. This is because they are easy to lose hearing. Second is blood pressure check. This is to monitor the hypertension. Third is thyroid gland. This is to monitor hypothyroidism, which is the thyroid is underactive. Fourth is glucose level check. Glucose level check is through the blood and pee to screen for the diabetes. And the last one is bone mineral density check. This is to avoid osteoporosis.